Welcome to the Remote Therapy Summit. My name is Dr. Emma Shapiro, and I'm so excited to have you here today to talk about working remotely and the time freedom you can have when you are owning a value-based home healthcare agency. I'm here with Shainna Young. She is the CEO and occupational therapist of Inspire Home and Health, and also Optonome. And so she's going to be sharing all of this amazing content, and I'm so excited to have you on. Thank you so much, Shainna.
Yeah, thank you for having me. I love this first summit that we're having for this year, especially with COVID-19. I feel this came at like a really right time, Emma. So thanks for having me on. And I'm an occupational therapist of almost 10 years. I really was getting burnout and I wanted to start something new, but I was like totally scared to start something new until I had a platform called Optonome that really helped me to get where I am today. So I want to talk about the ability that you can work from home or anywhere. If you want to go to the beach for the day, or you want to go to Chuck E. Cheese for your kids for the day, you can work remotely anywhere when you have your own home healthcare agency. And as a result, you're able to have time freedom. I also want to state that you can still have that direct care. So you can work remotely from home, but you can also still be on the ground. Having a home healthcare agency allows you to have both. So we're going to talk about that.
Awesome.
Alrighty, so the objectives for today. So just like any business, you got to have a target market. We're going to talk about that. So why having a community-based home healthcare agency is so desperately needed. And what is the target market for a community-based home healthcare agency? I want to bring this up from the start. This is not Med A. And I know many of us are used to Med A. Even when I was thinking about starting my home healthcare agency through Optonome, I was thinking, Med A, PDGM, and PDPM, like that's really hard right now to do. But we do not focus on those services at this point. There are many other services that you can provide other than Med A. So we're going to talk about that. We're going to talk about the roles of the CEO, which is you, the healthcare professional in a home healthcare agency. Again, we want to be the game changers, and many traditional home healthcare agencies have people in business and administration, and we want to put the healthcare practitioner first, because you are going to provide value-based care on day one and see the person as a client that has goals versus seeing them as a number. So we're really trying to game change this and talk about what your role is as a CEO in a traditional sense, but also if you have your own autonomy-powered home healthcare agency. And then we're going to talk about how you can work remotely from anywhere. Like I said, Chuck E. Cheese on the beach. Yeah. I'm a mom, so I was like, why don't I just bring up, if you want to work somewhere other than home.
No, I think that's so important. I think that's like why a lot of us are frustrated in healthcare, is because like we work really hard and we like to serve our patients, but ultimately as we get older, and especially as a woman, like I'm starting to think about having a family, and it is a little frustrating for me to feel like, I won't be there as much for my kids. So finding a remote job that you can still use your skills is so valuable.
Yeah, you definitely hit it on the head, Emma, because I think we're all like driven to work super hard. I know you are, Emma. You work incredibly hard. And I'm the same exact way. And then once I had my daughter, I was like, you know what? I'm still a good therapist. I don't have to work a tremendous amount of hours in order to show I'm a good therapist. So, that's where my mind shifted, that I really was trying to find that balance. And yeah, that's where it brought me to this point. So the next thing we're going to talk about are the steps to licensing. So having a community-based home healthcare agency, you get qualified in non-medical services and medical services. So I just want to, start to talk about that concept. For us as therapists, we're so used to just one service, PT, OT, speech. With having your own home healthcare agency, you can get qualified in at least 10 to 20 different services that you can provide, which is so important, especially if you're trying to make yourself recession proof. If you just have one type of service, you can only provide that one type of service. But when things happen like a pandemic, you now have 10 to 20 different services that you can get yourself in a recession-proof type of setting. So, and home healthcare agencies right now are so needed right now for the pandemic. And then lastly, we're going to talk about the financial aspect of owning a home-based healthcare agency. So, what are your revenues? I want to talk about literal numbers, if you have your own home healthcare agency. So what got me here? We already kind of talked about it a little bit. I became a mom. But I worked in really good settings in Pennsylvania. I worked in top clinics. I'm not trying to say that to be, oh, look at me. But even though I was working in these incredibly awesome settings, I still had to document like crazy. And I still had so much in terms of insurance-based that was preventing me from doing therapy. And it really hit me one day. I had, I always gave my heart. I would always, I'd spend my time, money, anything for my clients. But then again, once I had a family, things started to change and my mindset really started to change. I remember one day I had 2 evaluations, 1 progress note, and then my next client came in, and in my head I'm like, I gotta document during this time or else I'm gonna be staying late, not seeing my daughter again. So I remember I was typing away and I could hear her starting to cry, but in my mind I was still like, and what's your pain schedule or what's your pain level? And then it really hit me what are you doing? I felt like I was already injured in my heart that I wasn't there for her. And I just felt like our expectation now as therapists are just ridiculous.
Yeah.
I don't know if you've had this mindset, Emma, and I'm not before I started my agency, I was embarrassed to say this, but now I'm not. Almost in a lot of my sessions, I kept thinking, how do I set up my client so I can do some work and they can do an activity on their own and I don't have to be hands-on because then I can type
Oh yeah, it's all about multitasking right now, which is it's so frustrating. It's so sad. I've actually had a number of people, and when they, say they have an injury and they come to me and they're just talking and maybe they're just friends or family and they're going to chiropractors first. Nothing against chiropractors. If there's any chiropractors listening, great, welcome. I'm so glad you're on the summit. But as a therapist, that's sometimes frustrating because what they were starting to tell me is that they're not going to therapy clinics because it was a mill, because they weren't getting the hands-on, they weren't getting that emotional support. And I know that the reason why I became a PT versus a physician was because I really liked that interaction. I wanted to be there for my patients. And with all this paperwork and the rules and what you said, the productivity standards with lower reimbursements, we're really not being able to be there for our patients as much. Yeah.
Yeah. You said it exactly. I feel like we're in a mill, it's just an assembly line, get the next one. And it's wait, why do I work in the #1 rehab in Pennsylvania and I'm still with that mindset? This is supposed to be about value care and I'm not providing value care because my mind is always thinking, but then I have to do this and then I have to do this. And yeah, so I need to get out of it. All right, so if you want to work from home or remotely when owning your home healthcare agency, let's get back into your target market. So in general, for traditional home healthcare agencies, there's a lot of times three markets you can get into: pediatrics, older adults, or adults with disabilities. We really focus on adults with disabilities and older adults if you have an Optonome powered agency like I do, because the CEO of Optonome, Dennis Dicker, has expertise in this area. He knows how to scale it in terms of other states and be able to focus on these value-based services, because again, we're focusing on this market as providing value care first and not seeing the client as a number or productivity. You have no productivity when you have a home healthcare agency. It literally only takes 10 clients, 10 adults with disabilities to earn a 6-figure salary. I'll get into that, but just allowing you to know that it only takes 10 patients or 10 clients a week in order to provide care that you want and still make a 6-figure salary. I feel like you can finally start to get your work-life balance.
Definitely. And it seems like, with 10 people, you can provide excellent care too. That's very, very, very manageable.
Mm-hmm. Totally. With you, with your staff, you have a mentorship program with this type of model. And you get to see them for years. It's just a really cool type of area. So I want to review the facts because I want you to know like how much for adults with disabilities and older adults this area is needed. Okay, so let's talk about adults with disabilities first, more specifically autism. So this statistic is really sad, but nearly 90% of adults with autism can't maintain or find a job. Once they become an adult, there's many different terminology, but they call it like the drop off. So they get so many services in early intervention, so many services in school. Well, hopefully they get services. But once they hit adulthood, those services get cut drastically, or the knowledge of how to find these resources are very hard. So a non-medical service that you can provide is called supportive employment, and it's through Medicaid, and you can provide the skills to help them, one, find a job, and then learn the skills to have that job, and then three, maintain that job. That alone could take 2 to 3 years. So you're with them for 2 to 3 years, really fine tuning their ability to have a job that Medicaid reimburses. So you can really, if you have an agency, hope to reduce this statistic, which I find really incredible.
Definitely. There's so many. I grew up with a lot of special needs. My uncle has special needs, and I actually was a special needs education instructor, a TA at first, and then became a teacher. And so this is really close to my heart. And it really is sad that we have a lot of services for pediatrics, but I see so many of them go down these really challenging routes as they get older, and there's nothing to help them live a good life in society. So that's really neat. I did not know that you can help provide jobs as part of a home health agency.
Mm-hmm. Yeah, you can actually help them provide a job, and this service is actually for you as your agency. You do very well when you provide this service. So this non-medical service is one of the highest reimbursements that you can get. In Pennsylvania, it's $68 an hour. And again, your staff is doing that work. Your staff is the one helping them to find and maintain the job. You as the CEO are going out and providing that mentorship program to help your staff get better and better with your client. But your staff is the one that's making $68 an hour. So don't think of it as like, wait, but as an OT, I normally get, this much amount of money providing care. Remember, you have a team of staff and you get a portion of that. So it really adds up. It's a really great service, and it's awesome that we as the agency get paid well for it. Another statistic is 50,000 teens with autism enter adulthood each year and age out of services. So this is happening across, the US. Actually, there's new statistics showing that the rate of autism is going up, and those numbers are probably likely to be a little bit higher in the next upcoming years too. And then as compared to those without a disability, people with disabilities are more likely to live in poverty, be overweight, unemployed, and earning $10,000 less than a person with a disability. So again, I brought that up because all of those things you can actually provide non-medical services for. So poverty, you can actually provide subsidized housing or affordable housing for your clients. Overweight, you can provide non-medical services to help them learn healthy living, including healthy cooking, exercising, understanding their health conditions. Those are all reimbursed through Medicaid. Medicaid is one of the number one payers for adults with disabilities. Unemployed, talked about the supportive employment, and earning less than $10,000 less. So you can advocate for your clients and get them the salary that they deserve if they have the skills needed. And I also want to say too, like having a job, just like anyone else, like having a job encourages independence, reduces autism symptoms, and increases daily living skills. So if you can give someone a meaningful job, if you can give an adult with disabilities a meaningful job, overall, yes, it's going to benefit that person, but it's going to benefit the community. It's going to financially benefit your agency, yes, but overall, it's going to help even society. So, there's a huge cost for people with autism, especially as they age older. So if you can give them a job, you can really reduce a lot of these statistics. I wanted to show some maps, across the board, is this a target market for me in my area? Well, if you're looking at people with disabilities is, again, anything with a mental, physical, autism, intellectual disability, a motor issue. So it's a collection of things, but look across the US. The lowest number of someone with disability is around 9.9. So the need for it is across the boards. 1 in 10 have a disability that your home healthcare agency can provide. And then if you look at this across the ages, and this is the part that got me holy cow, we spend so much money in early intervention and in schools, which is super valuable, not taking that away at all. But we drop services after they age out. And if you see the age distribution in the US for people with disabilities, from 0 to 17, it's less than 10%. So everything else, ages 65 and older, 41% have a disability, and 18 to 64, 51%. That's over 90% have a disability after they age out. Things can happen like a spinal cord injury or things like that. So, as you age, you can develop a disability. So it's incredible that we have so many services before 21. And I try to advocate a lot that a disability is across the lifespan, and we really need to focus on that.
Yeah, I agree 100% with that. Yeah.
Okay, so older adults. Well, I think most of it's pretty clear, of course, baby boomers, right? But I just wanted to let you know, these are some facts, again, that you can provide non-medical services to help them. So fact one, around 80% of older adults have one chronic condition, and then 77% have 2 chronic conditions. So again, you can manage that as a healthcare professional. You can see the whole picture. How do you, if you're looking at diabetes, how do you manage diabetes physically, emotionally, in the community? Are they having all the services in place in order to manage their diabetes? You can provide non-medical services to help manage that and get reimbursed. That's through our highest payer is Medicare Advantage, and we do private pay and private insurance, but Medicare Advantage is one of the biggest payers for older adults in terms of autonomy-powered agencies.
Okay.
And then every 11 seconds, an older adult is treated in the ER for a fall, and every 19 minutes, an older adult dies from a fall. And I really like to stress this one as well, because we normally see them Med-A once they're home after they were hospitalized after that fall. But let's do a proactive approach, and let's see them before the fall. You can do home modifications, and you can see them well before they are hospitalized. Again, this is a community-based home healthcare agency, so you can provide non-medical services to look at the person, again, as a healthcare professional, and decrease their risk of falls before they even have one. And then this is the one that I'm very big about mental health. So this was the one that floored me, was that 1 in 4 older adults have a mental health disorder, and older adults 85 plus have the highest suicide rate of any age group. And again, maybe you're feeling this way, but social isolation,
Yeah.
we're all feeling it. So imagine them stuck at home all the time. Isolation is a huge killer in the United States. It increases health conditions, it increases, of course, depression, but it also shows other horrible things like suicide rates. So again, if you're able to go out, provide non-medical services, and you provide that clinical oversight and see that person as a person versus a number, you can really help to reduce a lot of these facts. So the goals are to show these facts, but also in a couple of years, we're hoping that more people start agencies and focus on value care and reduce these numbers.
Oh yeah. My biggest frustration, I work for the VA, and so when I send people home, I get a lot of returners, and it's always so frustrating. It kills me because I always do feel like I wish there were more people to check on my patients. My patients are in that group that you talked about, where they're in that, 70 to 80 to 85 range, where they have some beginnings of dementia or Alzheimer's. They've got, they can't really truly care for themselves, although they think they can. So they come back to me malnourished. They come back to me very deconditioned. And if there was only just more programs in place to check on them and to combat the social isolation, to combat the deconditioning. All they really need is that occasional checkup. And I think we could prevent so much hospitalization. There really is, it's really neat to see that you can focus on preventative measures with the home health agency.
Yeah. Yeah, I mean, this is like the number one thing is we want to prevent what's going on before it actually happens. And again, the community base. But yeah, it is so sad. And it's just like, I think there's a lack of awareness. So that's just the first step, is bringing this awareness to the table. Okay, so when having an agency, you need to set yourself apart from other agencies. Just like any business, you need to have your unique values that are different than others. So having a community-based home healthcare agency, you want to bring value care. Optonome already has that incorporated. So if you wanted to start an agency with Optonome, you already have these values in place. But really what is lacking right now in traditional home healthcare is two big things. One, staff, which are normally called home healthcare aides or direct support professionals, they are underpaid across the boards. They are not getting livable wages. And as a result, they're extremely burnout. And they don't want to work the way that they want to work, because if you think about Maslow's law, which is like they're just trying to survive, how do you think about handling your client when you're just trying to make a living and you're underpaid? So there's a huge turnover crisis with a lot of staff. And the other thing is that these traditional home healthcare agencies, as a result of that cycle, they're seeing a lot of the times the client as a number. More numbers means more revenue, and they have to make up for the turnover crisis. But with Optonome, you cap off at a certain number of clients because you provide clinical care. And that's the third thing for traditional home healthcare agencies. The non-medical services, the home healthcare aide is not getting an OT coming out to help them. They're not getting at most, they probably get a nurse, but the nurse doesn't come on a weekly basis or a monthly basis for Optonome powered agencies are. So we really need to bring back value-based care, and the only way to do it is to cap off. So you see probably at most 30 to 50 clients at most, and that's it. You're with them for years. You're not trying to focus, got to get more numbers. Your adults with disabilities, you're with them for years. So it really only takes 30 to 50 clients to max out. And like I said, it takes 10 clients to earn a six-figure salary. So again, the reason is we want you to go out to see every client, as well as working remotely from home. So in order to do that, we don't want you to focus on a lot of numbers.
Now, is that just to clarify, is that like that's 10 clients per week, and so that's 30 to 50 clients like total that you have like ever. So that's not per month or anything. That's sort of the cap where you feel like there's the ideal balance between earnings for employees, earnings for the home healthcare agency owner, as well as the best care for patients.
Yeah, you're exactly right. And that's why I've been kind of calling it now mini home healthcare agencies, because you really do, if you're seeing adults with disabilities and older adults, you're capping out at most 50 people. Because for adults with disabilities, you need to see them one time a week because of the behavioral component that they have. And older adults, you're seeing them one time a month. And again, that is not happening in a traditional home healthcare agency. If they have non-medical services, there's not a healthcare professional coming out. And we really want to change that. But that's how it makes you really valuable, because so I'll talk about the next thing. So what are your unique services? Clinical oversight. So again, most of your staff is going out to do most of the direct care, but for one client, you're seeing them for 1 hour a week. Okay, so in a traditional home care, it's few to none that a clinical healthcare professional is coming out. And it's usually only the nurse that comes out to supervise the non-medical services. But with Optonome, it's a full service. So they're getting all healthcare providers to come out to manage their non-medical needs. So what I mean by that is I'm an OT, so I'm providing for adults with disabilities 1 hour per week per client. So as an OT, I'm going out and providing that clinical oversight and supervision to my staff to better help with their goals. But if I see a PT need, then I can just go on the Optonome platform and say, hey, Emma, my client is getting older and I see their gait is looking funky. I do not know what this is. Can you help me? And and you have that ability, because now we've grown to 70 healthcare professionals. You have 70 at this point healthcare professionals to reach out to and have a clinical network. So that's how you can have that full spectrum of healthcare clinicians. Okay, and then the other thing, I'm not going to get into this too much, but CMS, PDGM, PDPM, they're all focusing on this, social determinants of health. And autonomy-powered agencies cover almost all of these areas, except for early childhood education. But hunger, we can actually help them with providing a subsidy to help them if they're having an issue like that. And we can teach, maybe they're having a hunger issue because they're spending a ton of money on video games because they don't understand how to balance. So budgeting, learning financial management, how do you look when you go to the grocery store, find the cheaper option? Those are all non-medical services that you get paid through Medicaid. So you can focus on all of these areas and be able to focus on the social determinants of health. So if someone, in your state says, are you focusing on the social determinants of health? You say, yeah, I'm focusing on all of them except for early childhood education. All right, so who can become the CEO of your own home healthcare agency? It's 5 categories. So I'll break it down of who can actually be it. But if you wanted to be an autonomy-powered home healthcare agency, you have to be an OT, a PT, an SLP, a behavioral specialist, or a nurse. Because
so no assistants, no PTAs?
Assistants can partner. Yeah,
okay.
That's a really good question.
Okay.
Assistants can partner, but in order to provide, once you go medical, once you go direct therapy, a CODA or a PTA can't provide that direct therapy initially. So you need to have one of the 5 categories, OT, PT, speech therapist, behavioral specialist, or RM, because it qualifies you to provide the non-medical and medical services. But a CODA or a PTA can form a partnership with one of these 5. A PTA can form a partnership with an RN or
Gotcha.
Or a speech therapist. Doesn't have to be a PT with a PTI. So
gotcha.
Yeah.
So these divisions could do it on their own, or they could partner together. And if you're an assistant, then unfortunately you have to sort of be like a co-owner and co-own it with a higher level therapist, like a PT or an OT or an SLP. Got it.
Yeah, exactly. Because if you go back to the social determinants of health, provider availability, so healthcare system, provider availability, and quality of care, that's how, the people that have the master's degree or above can only do that. A provider, if they need direct therapy, then it's only that OT or PT or speech therapist that can initially provide it. And as well as quality of care, having that higher level of education, you can provide a transverse level of skills, clinical skills, in order to really focus and hone in on that client.
Gotcha.
Although I agree, CODAs and PTs are super valuable.
Yeah, sorry, assistants.
You can partner, you can totally partner.
Yeah, I mean, could you, I'm just thinking out loud, because we do, there are a lot of assistants that are constantly asking questions in our alternative careers group. So could they be like just an owner, so to speak, and then try to delegate everything to therapists, like to PTs, to OTs, to SLPs, or they cannot?
That's a really good question, but they would have to partner, because in everyone's state, you have to have certain regulations that you go through. Okay. So that CODA would have to go through their state trainings, but then that other person would have to go through their state training. So it would take even once they hired that person, then they would say, okay, now you have to go through all these trainings. So it's not financially and time
Gotcha.
Optimizing. Yeah. All right, so what are your roles and responsibilities when having an agency? In general, if you're just a CEO in a home healthcare agency, you do 3 things. You manage your clients, you manage your staff, and you manage your agency. When you have autonomy to assist you, Optonome, again, focuses on that care value-based approach. So you're providing clinical oversight. If you're working with adults with disabilities, can you see my mouse or no?
Yeah, I can see the mouse.
Cool. So if you're seeing adults with disabilities, it's weekly for 1 hour. Older adults, it's monthly. And then you get that real-time intervention. So you can constantly be in check with your staff through the Optonome app. So you're able to do that. So I put that as remote and direct because most of the time you're going to be working remotely, but when you're seeing your client, that's when it's direct for 1 hour. So the next one is managing your staff. You know, I talked about how we had this huge turnover crisis that's going on across the states with traditional home healthcare agencies, and Optonome actually trains your staff, hires your staff. You do the interview process, but Optonome is the one that does their background checks and getting them trained and everything. And they are your independent contractors. So they're essentially, because they're independent contractors and because they can actually go to other different agencies, we can give them not only livable wages, but the ability to earn up to $50 an hour as a direct support professional. So we don't call them home healthcare aides because as a direct support professional, they can provide non-medical services and some medical services. So they have many different hats. And depending on how much they want to get trained through Optonome, you're not training them, it's on their own if they want to earn more. Optonome will train them to other positions, and Optonome will give them the ability to earn $50 an hour. That's how you retain them. You give them livable wages, and you give them a mentorship program. So every week I'm going to be with the DSPs and helping them to learn new skills and have a clinical oversight so they can feel empowered if they want to, you know, advance themselves and provide the best care for your clients. So it should be a win-win.
That is huge. You know, I work closely with aides, you know, because my uncle, and I'm constantly talking to my grandma, and she has a lot of aides that were coming in to help him. And this was really a struggle for them, you know, just to put people's perspective, you know, they are often getting maybe just $7, $8 an hour, and their gas is not paid for. So they're driving to all these different homes, and that driving time is often not included. And it's really tough. They're working really long hours. They're exhausted, you know, and they're wanting to move up. Just like in healthcare, a lot of us therapists were burnt out because we don't see upward movement. I mean, providing this upward movement to them is so valuable. And the cost of retraining someone, not only in time and in opportunity cost, but also financially in spending that money to retrain, is actually really expensive. I don't recall the exact number, but like traditionally, I think it's like $20,000 if you have to get a new employee, train a new employee. So, I mean, if you can keep someone and retain them, you know, it's just going to be that much easier just to run your home health agency.
Mm-hmm.
Yeah. And that much better for the aides. I really think that this is such a better model for their lifestyle too.
Yeah, let's make them just like us. We're struggling. Let's make them feel empowered. Let's make them have livable wages, and let's value them because they are the glue to our agencies. So, you know, we want to give them what they deserve just as much as we want to have like our time freedom and like when we're working remotely from home, you know, are things that we feel valued. So yeah, it's definitely a game changer in a good way. The last thing is managing your agency. As a CEO, you need to manage your agency, but if you have an autonomy-powered agency, it manages it for you proactively. So for example, you know, you need to be federal and state compliant. And, you know, when you're going out to see your client for the week, for the hour, Optonome will probe you. It'll send you like a direct message. Hey, did you check the fire alarms in their house these last 6 months? It's time to check their fire alarm. So you check, or your fire detector, so you check it, and then you say yes or no. If it's a no, how did you correct the issue? And that's it. It's proactive, so you don't have to spend time thinking, how do I keep my agency federal and state regulated? Optonome does it for you. And that's all remotely and direct as well. Okay, so I wanted to show a little video about what a direct support professional is, because this is the glue of your agency. And I just thought it would be better just to show a visual because I'm a visual learner.
Awesome.
Okay. So I know many people are used to, like in a home healthcare agency, seeing that home healthcare aide, but the direct support professional, which is very common use terminology when you hear about adults with disabilities. If you go to Indeed.com and type in direct support professional, you'll see a lot, but you'll see that their salary is like super low. But again, they focus on many non-medical and some medical services to help. I guess we'll go to the next slide to help them. Age in place for older adults. So your staff helps your older adults age in place, or for adults with disabilities, live independently with support. And again, they're doing a lot of the direct hours, which is why you're able to remotely work from anywhere, because you provide that clinical oversight remotely on your phone or your laptop, and then go out directly for a 1 hour week per client. Okay, so when providing non-medical medical services remotely from home, what are you specifically doing when you're working remotely from home? Okay, so when you have the Optonome platform, you're reviewing the documentation of your staff's notes, billing, federal and state compliance tracking, and staff monitoring. Did they get there? Oh my goodness, my staff didn't show up. Well, this is the other thing I like about it. Optonome actually has like a time system check-in. So if that DSP doesn't start driving or moving in the direction of your client within 30 minutes before they're supposed to start, Optonome will send out another notification for another DSP to go out. Because sometimes some DSPs unfortunately don't show up. So Optonome actually automates that whole service. If someone were to, one, call out, or two, not even show up, Optonome does it before you even know it, because again, Optonome has that staffing pool of these DSPs that you're able to utilize because they're independent contractors. Does that make sense? I know that's like a
Yeah.
lot.
No, and that's really helpful. I mean, it sounds like it's a pretty much like a full service software that helps, do so many things. And that's actually really important because staff all the time, monitoring your staff and making sure that they're attending these appointments can be really challenging. So that's really helpful.
Mm-hmm. But I also like to say, like, monitoring your staff can be a cool thing. Like, maybe your adult with disability learned how to cook something on the stovetop for the first time. So you can be like, you can reach out to your youth, being like, you're awesome. You helped teach them how to cook on the stovetop. Like, so proud of you. So, it's not just about what they're not doing. It's also about, like, again, empowering them, making them feel good as they should. So, like I said, your staff provides those non-medical services directly, and some medical services. So a medical service can be providing their medication. That's a medical service that they need training on, that they can get trained and help to provide that medication management that they need. Okay, so steps for licensing. So just in general, for if you're getting your agency up and running on your own, you need to come up with a name, just like most businesses. You need to create your logo, your vision and mission statement. With Optonome, again, you think of your name, but then you sign that business agreement that you have, that Optonome will help create your agency and then also be your complete back office when you start. Because, oh, actually, I forgot this, Emma. I guess I didn't put it on here. Oh, so the whole back office, like all of this right here, that non-medical medical service working remotely from home, it should take you 30 minutes or less a day.
Oh,
So
good. I
even
was actually going to ask that question. I forgot too.
yeah, so on the days that you're not working directly on site, it should take you less than 30 minutes to do this work right here. Because again, Optonome automates all of this. You're kind of just that last stage review, make sure that it's okay, send it off to billing. Optonome does your billing. Optonome sends it out to the payers. You know, everything with the checks. Optonome does the checks for your staff. Like you monitor it all, make sure that it's to your standards and correct. But on the days that you're not providing direct care, you should be working less than 30 minutes a day, which is, again, that time freedom that most people I know are looking for.
That's amazing. So what do you say on average, like a home health agency owner works like per week? How many hours about? And let's take those and let's take it on average if it's like that 6-figure, 10 patients a week type of agency.
Yeah, so I'm going to get into this in more detail. If it's 10 hours a week, 10 hours of direct care, you as the CEO, so 10 hours means 10 clients. You're going out for 1 or 2 of those days. If you want to work a 10-hour day and see all 10 same day, go for it. I'm not that person. I'm going to break it up to 2 days, 5 clients, 5 hours one day, 5 clients the other day. The other 3 days of the week, you're working remotely from home, and that should be 30 minutes or less. So in total, if you're working 10 direct hours, it should be like an hour and a half for 3 days total that you're working remotely from home. So you have a lot of other time to focus on your family, aka what I'm trying to do. And I also do a nonprofit that I also try to spend some time on with.
Awesome. So maybe about 15 hours a week, and that's including your
Yeah.
direct care that you're actually spending on your agency. Now, obviously, it's going to take some time to get that up and running at first, but then once it's up and running, that's that's like a third of what you'd normally work in a 40-hour work week.
Mm-hmm.
So
Exactly, yeah. And like I said, the good thing is once you have your client, you're with them for years. And Optonome does your marketing too. So you don't have to recruit your clients. Optonome does the marketing for you. So again, that saves you a lot of time as well. Okay, so we go to step 2. You get your background checks. You know, Optonome starts to create your logo. Based off of your color scheme that you want or ideas, Optonome will create that for you. Step 3, you need to do your trainings, your state-specific trainings. And if you're working with adults with disabilities, you need to do your Medicaid training. So every state has a different Medicaid training to do. It is super complicated to navigate. I have been in it. I was like, thank God I have Optonome. I'll give you an example. I had to do in Pennsylvania, you have to do a live training. You have to go on site, you have to learn some things about Medicaid. Some states you don't. But I went in there and I was with 15 other people in the same position as me, trying to become a CEO. And they were like, yeah, I took this course 3 times because I failed it. I couldn't get my paperwork in. It was really hard to create the policies and procedures. Even people in the class were like, can someone help me create my policies and procedures? Like, this is the second time me doing it. And the whole time I'm like, whoa, thank God I don't have to do this. I can't do this. So yeah, everything has just been a really smooth transition because Optonome does that back end work where it becomes really challenging. So your LLC, Optonome creates it, your policies and procedures, which is gold. You need to have really good policies and procedures to keep your business safe. And Optonome creates that for you. And then, so step 4 is your LLC and your policies and procedures. And then step 5 is the documents that need to be sent to your state. Optonome does that for you. Optonome sends your paperwork to get qualified with multiple payers like Medicaid, Medicare, private pay, Medicare Advantage. So Optonome gets you qualified under multiple payers. And then you just wait for your agency to get approved. And then once you're approved, Optonome then continues to stay with you as your back office as well as your mentorship program. So you're with them from start to finish. And even when you have clients, Optonome is still with you. And you also have like like I said, right now, 70 healthcare professionals at this point that you can connect with. These are so many other CEOs that you can continue to reach out to. Okay, so how can I get started? What's your time commitment? So when I was still working basically full time. I had a per diem job that was basically giving me full-time hours. So I was able to get started through Optonome with a full-time job, and I didn't feel it was stressful at all. I'd work my full day, I'd come home, spend time with my daughter, and then I'd put her to bed, and then maybe like 30 minutes here, sometimes an hour here, I would do my state-specific trainings or upload my background checks or approve, look at my logo that was being created. But it wasn't hard not to manage while having a full-time job. So you can definitely do it. It's very, I don't want to say it's very stressful. It's easy to do if you have other expectations right now. So you don't, people have said, should I quit my job? No, do not quit your job. It's a gradual process. You'll get there, but we want as stress-free as possible so you can get started while working a full-time job. And then once started, if you still want to maintain your job, like, go for it. You can make this full-time, you can make it part-time. Some people have said, can I make it my side gig? You can do whatever you want. Like I said, it only takes 10 hours to start making that six-figure salary. So this is your business. That we want you to have time and financial freedom. It's what you value. If you want to make more, if you want to work 40 hours, go for it. Me, I want to work 25 hours. That's it. I want to have a good balance.
Yeah, it's flexible, right? So, I mean, we're using the number of 10 patients or 10 clients, but that's just like a round figure number. And that's, everyone would love, I think 6 figures is sort of like the goal that everyone has, because that's a goal that's like a very, livable wage in today's world. And so, but yeah, I mean, if you wanted to incorporate this, you could easily do just like 5 patients, right? Shainna, it doesn't, it could be anything. It could be 3 patients.
Yeah. It's how you want to run it. It's your business. There is no productivity level with this. Alrighty, so financial revenue for 1 client versus 10 clients. Let's talk about that. So in the beginning model with Optonome is we focus on adults with disabilities first, because that is really Optonome's big niche. And it is the quickest way to financially get where you need to be. Because again, for non-medical services, adults with disabilities get a higher reimbursement rate. Older adults get a lower reimbursement rate. So we focus on adults with disabilities first, and we provide non-medical services first. So you're not going to provide direct PT or speech therapy first. That may happen 6 months to a year after your agency gets started, but you can make a 6-figure salary just off of non-medical services first. So the average reimbursement rate for non-medical service is $36 an hour. And that $36 an hour is that your staff, your DSP, is helping your adult with disability learn any type of life skill. So let's break it down. So $36 an hour. And again, we want to focus on a lower number of how much that DSP will see your client. They can see your client anywhere really from 25 to 50 hours a week, but we want to go on the lower number just so you can see like what's I don't want to say worst case scenario, because you're like minimum. There we go. Much better. So 36 times 25 hours that your DSP is doing it. So don't think again, 25 hours me. No, this is your staff doing 25 hours a week, $36 an hour. So for the week, for 1 client, that's $900. These people need to be seen every week. So 900 times 52 weeks is $46,800 for 1 client. So when I say you can make a 6-figure salary with 10 clients, whoops, I got out of it for a second.
That's okay.
You're like, wait, but this is the best part.
I know, come on.
So if you provide clinical supervision to 10 clients, $46,800 times 10, that's $468,000 for 10 clients that you're seeing. So that at 10 is 10 clients and 10 hours that you're providing direct direct oversight. So it doesn't take that much to start earning a 6-figure salary. So that is gross profit, okay? So I also want to talk about net profit. Again, I just want to stress that 1 client equals 1 hour a week that you're directly on site, and 10 clients means 10 hours a week. So again, the rest of the time that you're not there, on the days you're not there, you should be working less than 30 minutes a day, meaning time freedom. Okay. So this is the yearly comparison for I'm going to show you the yearly comparison for traditional home health care, and then if you have an Optonome powered home health care agency. So again, when you're looking at, this is the 468,000. This is working 10 hours a week, okay? So this is the gross that you're making. And of course, with traditional and Optonome, you're pulling in the same amount. But then this is where money starts to go. So again, the DSP crisis, recruiting, training, overtime. Studies show that there is a turnover rate of 80% of your staff turnover within the first year. So yes, you do lose a lot of money as a result.
And that's largely because of that non-livable wage. You give them a livable wage, you give them a career, and they'll stay with it.
Yeah. I mean, it's just, even us, we're not going to have a job if we're going to be underpaid. So there's only so much you can put up with that before you're leaving that job. The marketing, scheduling, expense management, care management, billing and payroll, that is all done with Optonome. So again, that's how you save a lot. So for the most part, they have to spend a certain amount of traditional home healthcare agency, a certain amount of money. But Optonome, it's only 10% of your total revenues to manage all of that. So in the end, when you pay out your staff, so here's the wages, this is how you pay out your staff, okay? We were actually nice in this, and we said that they were getting paid $18 per hour, but they're likely not. But we're like, let's just give them both the same rate. The gross profit is around 100, net profit is around 187,200 versus a traditional at 77,664. So it's a 40% profit margin, and you're providing value-based care, which is the important part. And that's why, traditionals are spending a lot of money, because they're making up for these issues. So again, if you want to work 10 hours a week direct care, that 10 hours equates to 1 to 2 days on site and 3 to 4 days working remotely. So I just wanted to show these pictures. This is Pennsylvania. Each one of these people are CEOs. So we have a behavioral specialist, a nurse. Kyle, he is awesome. He's getting his agency up and running right now. Liz, who's a speech therapist, she's getting her agency up and running now. We got another OT, nurse, OT, and nurse. And there's my OT. I'm actually holding.
Is that your baby?
No, that's actually Liz's baby, the speech therapist. So I was like, oh, I'll hold him. So yeah, we all met up one day, but I just wanted to show, this is my community here in Philadelphia, and this is growing across the United States. Yes, you can definitely, you have that remote clinical network on Optonome, but it's also nice to have, your clinical network at the palm of your hand. So all these people are close within me, and our agencies we don't compete, because again, when you have 50 clients, you really can't compete. There's more than 50 clients in your town that need services. So, here's my home on the right. Here is where my adults with disabilities are going to be living. I'm not going to get into this because it's a big topic, but Optonome actually can find real estate for you, purchase the home for you. You don't own the home. You don't manage the home. You don't have to pay for the home. You just manage the clients within the home. Okay, so this is my home where adults with disabilities are going to be living very soon. Yeah, it's a really cool thing. So if, again, the behavioral specialist here, Kyle, if I may be doing a pizza party one week, and I'm going to say, Monday, we're going to have a pizza party, working on social skills. Any one of you guys, any of your clients working on that, you can come over. And vice versa with Kyle and his agency. Hey, Shainna, I'm doing an exercise class on Tuesday. If your clients want to come over, so it's really about community and really about, again, that value care.
Yeah, no, I really like the feel, one, you're making a home health agency very simplified, and I'm not trying to promote this in any way or not, but I mean, I look at business opportunities and I'm constantly sort of trying to be like, what's a good opportunity? And having simplified billing and scheduling and all those things is really easy, because something like this, there is a lot of rules and regulations, so it can easily be overwhelming. But to have that mentorship and that support and that guidance along with those tools, where all you basically have to do is, like, you're already seeing patients, but now you just own the agency that's seeing the patients.
Mm-hmm, exactly. So this slide shows the 70+ therapists and nurses that are getting started. I personally know all of them, but we're starting to grow now to the point where I'm not knowing some people. I really love connecting with everyone, but yeah, this is Tamara. She's out in Florida. She is an awesome OT. I cannot wait to see her agency, because that agency is just going to flourish. She's so incredibly smart and down to earth. Hung, actually, I went to school with Hung, and this is her husband, Arthur, and they're an OTPT agency. So they got 2 healthcare clinicians starting together. So it's just really cool to see how everyone's agency is starting up and growing. And that's it. That's my presentation.
Awesome. You did wonderful. I mean, I was trying to think of questions along the way, and I think you answered most of them. You were really specific on how much an agency can earn, the time allotment that we need for this, who is this right for, who would maybe be not right for this, if someone's thinking and inspired to do this, but they aren't quite sure if it's the best fit for them. Would you have any advice for that?
Yeah, I would say the people that, the one that strikes me the most is when people still see this as like a number game and not seeing the value-based services. So people will still say to me like, yeah, but I want to make a ton of money. So how many clients do I need to see? And they keep pushing the numbers versus like seeing the value-based care behind it. That gets me to think like, are they really in it for the clients? Because you do have to care for your clients in order to, I feel, have a successful agency. If you're only seeing them as a number, you're probably going to come across some issues down the line if you don't actually care for your clients. So people that are thinking more of this as a number type of a model versus the value care will probably, I normally say like, I don't,
It's not a right fit. Yeah.
I think you should go for a franchise. A franchise is what you should go for, is probably that.
Any other common questions you see, Shainna, that you want to address at the end here?
Oh, let me think. We're very transparent. So if you want to reach out to me, you can always reach out. Some people say, I want to see how this looks in my state. So we currently have 21 states that have moved forward. So I can definitely have you chat with any one of the therapists or nurses, give you their perspective and see how it's been going for them. But, it is a process. It does take 6 to 9 months to get your agency up and running. Every year as this rolls out, it will get faster and faster, but it is a process. So it will take around 6 to 9 months to get your agency started. But once you're able to get to that point, then you're really able to be able to have your goals of working remotely from home and that time freedom and that value care, that therapist frame of mind that you want to get back into with your therapy roots.
Awesome. Yeah, no, thank you so much for this presentation. It was great to see how, you can sort of blend remote working and still caring for patients and do it in a really value-based way, in a really way where you're actually going to make a huge difference. I mean, I can already picture so many adults with disabilities lives and geriatrics that their life is going to be so much better just because of the home health agency that you started, Shainna, and that all these other wonderful therapists are starting. So I'm just, appreciative that you're creating a wonderful business model that's going to reflect positively in the healthcare world.
Thank you, Emma. And thank you for all that you do. Having like close to 20,000 people on the ACG group. And people that don't know Emma, she is incredibly nice, down to earth, and super smart. She is there for you guys in the ACG group. So I totally give you so much recognition, and thank you for, this opportunity, for this interview. It was a good time. Thanks so much, Emma.
Thank you so much. And everyone, look forward to, our next summit interviews. We've got so many things coming up, information on virtual Pilates, just so many different things. I can't even remember them all. And definitely, where should people go if they want to find more information, Shainna?
Sure. So you can go to optonome.com, or you can go to my Facebook group, Home and Community Healthcare Entrepreneurs. That will help
Awesome.
give you more information.
Perfect. Thank you so much, everyone. And we'll see you in the next Remote Therapy Summit Talk.
Woo-hoo. Yeah.